Today we're going to go over carpal tunnel syndrome and how to discern if you truly have carpal tunnel syndrome or if you have just median nerve irritation. So I'm Dr. Sarah Sewell of Resilience RX, and let's talk about carpal tunnel. So with carpal tunnel, the median nerve is affected, and with it being affected comes some specific impairments that are different in here compared to if the whole median nerve is affected. So hang with me here. The median nerve does sensation in this area. However, the median nerve splits into multiple branches. Not all of those branches go through the carpal tunnel. Some of them pass over top. So the branches that do this part of sensation are over top of that tunnel. So if you have tingling in this area, like sensation losses, that's not necessarily carpal tunnel syndrome. That's going to be irritation, dysfunction, entrapment. Take your pick on the word you want to use of the median nerve somewhere along the chain that is not right in that carpal tunnel area. If you have sensation loss here, 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 and then on the back of your hand, on the tips of these three fingers, and you may have it just on that inside of that fourth finger too. If you have sensation loss there, that is true carpal tunnel syndrome. Now, why does it matter if we identify what true carpal tunnel syndrome is? Well, if you don't correctly diagnose something, you're not going to correctly treat it. And the diagnosis needs to come before the treatment in order for the treatment to be effective. So with carpal tunnel, the sensation areas are key. The motor function or the strength of the muscles are also key. So bringing the thumb forward, this motion, if I say don't bring your thumb back to your hand, so push into my thumb, if she doesn't have strength there or lacks strength there compared to the other hand, that's another indicator that the median nerve is affected in the carpal tunnel. So I'm going to bring your thumb and your pinky together. So I'm going to pull apart. If she can't hold this on her thumb, the pinky doesn't matter here. If she can't hold that, that's also an indication that the median nerve is affected. A different nerve called the ulnar nerve actually innervates a lot of the muscles that involve the thumb and some small muscles in the hand itself. So that is how you discern whether or not you have true carpal tunnel syndrome. I will say the large majority of people who have carpal tunnel syndrome that I see don't have true carpal tunnel. They have issues with the median nerve somewhere along the chain. So the upper traps on people, the pecs, which is right here, those muscles put a lot of pressure on that nerve, and the more areas of pressure you have on the nerve, the easier it is to have nerve irritation. The nerve irritation just may show up in different areas. So when someone's coming in complaining of carpal tunnel syndrome, I'm going to check their upper traps, I'm going to check their pecs, I'm going to check their nerve tension, I'm going to elongate that nerve. Does that reproduce your symptoms? We're going to poke along the length of the nerve. Where are those areas of tightness? Where are the areas of restriction? And what can we do to get you feeling better again? Because a good chunk of the time people have numbness and tingling in their hands, and the first thought, because it's the most common thing you think of, is carpal tunnel syndrome. And whether or not you truly have carpal tunnel syndrome is key in treating it effectively. I will also add a side note in here that surgery to fix carpal tunnel is just as effective as physical therapy to treat carpal tunnel, and physical therapy is a lot easier and less time intensive than having surgery and having to go through all of that. So if you have any questions or if you have tingling in your hands and you're like, do I have carpal tunnel? I'm not sure. I tried the test. It still doesn't make sense. Reach out, shoot us a message. We'd love to answer your questions.